A clarion call here that vaccines should be made a global common good. And while vaccine rollout has created hope, the process, according to the UN chief, has been wildly uneven and unfair.
Just 10 countries have administered 75% of all COVID-19 vaccines. Meanwhile, more than 130 countries had not received a single dose. And those affected by conflict and insecurity are at particular risk of being left behind. When pandemic strikes, we are only safe if everyone is safe. If the virus is allowed to spread like wildfire in the global south or parts of it, it will mutate again and again. And new variants could become more transmissible, more deadly, and potentially threaten the effectiveness of current vaccines and diagnostics.
Guterres called for a global vaccination plan that would be coordinated through a G20 emergency task force that would be responsible for implementation and financing. The emergency task force would be made up of all countries that have capacity to develop vaccines or to produce them were licenses to be made available, working with the World Health Organization, other technical organizations, and international financial institutions.
Pressing commitments and priorities.
As the UK calls for council action that would create vaccine ceasefires in order to reach vulnerable population groups.
Further action is needed now by the Council to call for ceasefires specifically to enable COVID vaccines to be carried out in those areas that have been so badly affected by conflict. That's why we're proposing a new resolution for this Council's consideration.
China warned against efforts to politicize the pandemic and called for vaccines to be a public good.
This is a relay race of working together to save lives. It is not a zero-sum game where one's gain means the other's loss. Countries need to replace division with solidarity and keep to the right path of cooperation to tide over this trying time caused by COVID-19. We need to resist prejudice, respect science, and reject disinformation and attempts to politicize the pandemic. In this regard, members of the Security Council must lead by example.
Striking a different posture, Washington's chief diplomat committed his country to strengthening multilateral efforts, including at the World Health Organization, that was vilified by the previous administration.
Today, I'm pleased to confirm that by the end of the month, the United States intends to pay over $200 million in assessed and current obligations to the WHO. This is a key step forward in fulfilling our financial obligations as a WHO member. And it reflects our renewed commitment to ensuring the WHO has the support it needs to lead the global response to the pandemic, even as we work to reform it for the future.
The Gavi Vaccine Alliance called the issue of vaccine distribution the biggest stress test for the multilateral system in a generation.
It's critical that donors and countries step up with additional funding, that manufacturers prioritize multilateral initiatives over bilateral deals with short-term profit, stop inequitable vaccine diplomacy, that research and development and essential scientific knowledge is shared, and that the family of nations represented by the United Nations pull together and prepare for the largest logistical effort in immunization the world has ever seen.
Council also heard that vaccine mistrust could undermine COVID-19 mitigation efforts, as actions towards earning community trust remains a critical factor in overall responses, both at a national and international level. Bryce-Pease, SABC News, New York.